Hi, I'm Pam Norley, and I'm excited today to be joined by Nancy Brown, the CEO of the American Heart Association. The American Heart Association works to improve the cardiovascular health of all Americans. And Nancy joins us today to talk about how COVID-19 is affecting the work of the American Heart Association and the people that it serves. So let's get started. As the COVID-19 pandemic continues, it's clear that it's having an impact in ways that didn't seem obvious at first. How is it impacting the population that you serve, and how is the American Heart Association responding to those needs?
The American Heart Association, of course, has long cared about the heart and vascular and brain health of all people. And what we've noticed in the pandemic is that in addition to it disproportionately impacting patients who have underlying health conditions like high blood pressure, type 2 diabetes, obesity, we now see that COVID-19 is contributing to new heart attacks, irregular heartbeats, strokes, vascular abnormalities like clotting issues, fatal arrhythmias, sudden cardiac death, and most recently, we have seen, especially in younger people, this development of myocarditis, which is an infection of the heart. So we wanted to think, how could we use the science, the brand, and the grassroots of the American Heart Association to help the country in this moment and to help people who needed us in this moment. And so the first thing that we did is we launched a series of rapid action research grants, and the demand was historic. We received 750 applications in just a few weeks, and it was really remarkable, the ideas of the scientists and researchers from throughout the country on the types of things that they were seeing that they felt should be funding. And so some of the grants we funded include work on looking at the disproportionate impact on African Americans and Hispanics. We are looking at issues around blood clotting, repurposing drugs, understanding this issue of myocarditis and the infection in the heart. And all of those have been important research initiatives that are ongoing. Frontline healthcare workers, of course, have been the unsung heroes in the COVID-19 pandemic. And the American Heart Association currently trains about 90% of every healthcare worker in America for their CPR and first aid training. So we quickly stood up a number of training courses to help healthcare workers who maybe aren't normally emergency workers or people dealing with urgent issues understand critical needs like intubation and respiration and ventilator management, so that they would be best prepared to help in their communities that they were being called on to help.
Let me take you back to the research that you referenced that's being funded recently. Are there any early insights that you have?
We are looking at repurposing existing drugs and understanding how they might be of benefit to people who are suffering from COVID-19. And we've been able to screen using machine learning and high technology a number of drugs, and we're narrowing down into a subset of drugs that deal with inflammation that we might find to be very useful in helping to treat the coronavirus. So this is something that's very much on our radar screen. We're seeing some really interesting work on this issue of clotting and inflammation that we believe will be very informative to understanding how the virus actually attacks the body and what's happening to the inflammatory system of the body. We also are really making some inroads in understanding the issue of health disparities in the coronavirus. And so those are some of the many things that we believe we'll find.
So that's remarkable. And I know that there are a lot of different ways that people can help. In addition to funding, how can our donors volunteer?
Volunteers are the lifeblood of the American Heart Association. We are the country's largest voluntary health organization. We have 40 million volunteers and supporters throughout the country who really help propel the work of the American Heart Association. And every single day, volunteers are the reason the AHA is successful. So we would love more volunteer help in our communities where we have a presence of helping address issues of social determinants of health. health. Our voice in advocacy and public policy at the federal, state, and local level are really important to making sure that there are favorable health policies that allow people the best chance to live a long and healthy life. And so there are many ways that people can become involved in our organization, and we really would welcome that always, but certainly during this global pandemic when the work of the AHA has never been more important.
Let me just wrap up with the 3 things that people can do right now to help with the medical needs created by the pandemic.
Number 1 is to think about the importance of valuing your own health and well-being. Taking care of your mental health, the health of those around you, making sure that you're eating right and exercising and following the advice of science and community healthcare leaders for mitigating community spread. Secondly is, help spread the word of the importance of continuing to get medical care if you need it for non-COVID related activities. People are not presenting to the emergency room or their doctors if they are having signs of a heart attack or a stroke at the rate we believe they should. And data is showing this. This is why we've launched a campaign called Don't Die of Doubt, to remind people of the importance of seeking emergency care if you're having the signs and symptoms of a heart attack or a stroke. So please help spread the word of that. People's lives are at stake. And then finally, give to charities that serve communities impacted by the pandemic. The charitable organization has never been more important. The need has never been greater. And we are so grateful to people who share their time and their treasures with organizations who can make a difference in the lives of so many people in this country.
Thank you so much, Nancy, for all that you do and leading the efforts of the American Heart Association. We're very grateful for all of that, and we're so appreciative of your willingness to share some of the vision and work that you're doing right now. So thank you very much.
And Pam, thank you so much for allowing me to have this opportunity with you today.